Hi, so it is week 36. I'm actually getting closer to week 37 on this Monday. And we are switching from enoxaparin to heparin. So I have my little heparin vial here, and if you were on enoxaparin throughout your pregnancy, you probably at some point are going to be or have been switched to heparin. The reason for that is it has 12 hours of blood thinning rather than the 24 that the enoxaparin has. So if I were to go into labor, I could still get an epidural, where if I went to labor and I just took my enoxaparin, it'd be 24 hours of blood thinning. I couldn't get an epidural, so that's one of the reasons that they switch you at week 36, because you can kind of, it's kind of a guessing game from that point. There was a shortage, so I didn't look like I was going to be able to get the heparin. I did get the vials. They don't have the pre-filled injections. They were completely out. There's a shortage, and they didn't even have the vials at my pharmacy. We had to call in from another pharmacy, and I had to pay out of pocket to get it. It was like the last batch left. It was crazy. So right now it's just been really hard to get the heparin. So I was able to track down like the last batch that a pharmacy had. And like I said, there's no pre-filled syringes right now. So I have the vial and I have my syringes. This one's twice a day because like I said, it's only 12 hours. So we do it in the morning and at night. And you have to keep it really sterile. I keep it in a bag, and we like change the bag out all the time. If you're handling it outside of it, Matt uses gloves, and you can't touch the top of the vial because then you contaminate it. So the idea of the areas is the same. With the heparin, you can inject in the back of your arms, side of your stomach. If you wanted to do the front, my stomach's I'm like really out there now. So it's too tight for me to like squeeze anything in the front to inject, so I always do the sides. And then if I do feel like I'm having contractions or anything like that, I would stop my injections. My doctor said to stop them 24 hours before if I feel like that's what's happening. And when I know I'm going into the hospital, stopping them the day before, just so that, if you can plan it, that's the best way to do it. Sometimes the babies come on their own, and then again, it's got a shorter life of thinning your blood, so you're still okay. But if you know ahead of time, then, my doctor said just stop it in advance. So Matt's going to come in and he's going to show you how to actually draw it up, because he's the one who's actually doing this now. And yeah.
So the few things that you're going to want to use or have ready are alcoholic pads. I use 3 of them, one just in case. Obviously your syringe, your medication, and then a pair of gloves. Now I don't know if she told you, but the medication is inside a bag because everything's got to stay sterile, so we use a different bag every single time we do this. I put my gloves on first, obviously to try and keep everything sterile. Make sure you get a pair of tight-fitting gloves, because if they're loose, it's going to make everything a little more difficult to open. So, first things first, we're going to go ahead and we're going to pull the medication out. The main part that you don't want to do is to touch the silver. The silver is what needs to stay sterile, and obviously the inside as well. There's like a little rubber cap, I don't know if you can see, but the rubber area, that is what you're going to be sticking your syringe in. Do not touch that with your hands. Try to avoid touching it with your gloves. The only thing that should be touching, besides the needle, is the alcoholic wipe. So that's going to be the very first thing we do. I'm just going to kind of rub over it, make sure it's sterile, and that's it. Next, to draw the medication, you're going to need your syringe. This is where having the tight-fitting gloves really comes in handy, because opening these sucks. Now these syringes, they go up to 1.0 cc's, which is actually 10,000 cc's of this. So we're gonna only do 5, which is 0.5, which is 5,000 cc's total. I've noticed that when taking this cap off, that the whole syringe sometimes comes off. So I pinch down here where the white is, and you can pop the cap off while keeping this part still attached to the bottom. So, first things first, I try to hit the same spot every time, right down in the center, and then straight in. Now you can flip your vial upside down. Again, you're trying not to touch the silver. It's somewhat difficult in the beginning, but you don't want to touch that. Now, I've only drawn 0.4, and there's a whole lot of air in there. That air is from between the top of the syringe to the actual needle. There's air that you can't get out. The only way to get it out is to draw first. Then you're going to flick, and that's going to move the air up a little bit on the syringe, and then you're going to push it into the bottle. And if she zooms in close enough, you'll actually see the bubbles once I get it right there. So there's a couple bubbles there. I'm going to do it one more time to make sure that all the air is drawn out of it, because you don't want to have any air in here at all. So, and I got a bubble, there we go. Get that bubble out of there. Put that all the way to the top. Come on. There you go. And then all the air goes right into the tube. Now that you got all the air in the tube, you can go ahead and draw your 0.5 cc's. Just right about there. And I'm gonna flip, pull the needle out. Again, still not touching. Now if you zoom in, it's 0.5 cc's. I'm gonna push just a hair on to make sure that liquid comes out. That's making sure that there's no air in there. You can flick if you want. If you see like an air bubble anywhere, they normally stick to the side. You just flick it and they'll float on up to the top. But I'm fortunate enough to just have liquid in there, no air. Alright, so that's how you draw it. Again, the 0.5 is right at the top part of the black rubber that's inside the syringe. You're not going to go down to here, obviously. So.
Okay, so I've been icing. This side's pretty beat up already because we're doing this twice a day now, but.
And like I said, I still have 2 more of these.
I thought you were ready.
I'm only going to be using 1. I keep 1 as an extra in case I open it and she's not done icing. And then I gotta throw that away and get another one. So I always have 1 extra just in case. So first, again with the sterilization, make sure that everything is clean. So you're not injecting anything that you shouldn't be injecting. You're gonna go ahead and take a nice pinch. You're gonna choose your spot and you're going to go straight in. Try not to go at an angle. And then you're going to inject the medication. Try not to do it too fast, but you also don't want to make her suffer by doing it very, very slow.
Mm-hmm.
So once you're done injecting, you're going to let go of the skin and pull straight out. Make sure you cover the needle with the cap again. As you can see, all the medication is gone. Make sure you store these. We've been putting them in a gallon jug of water that no longer has water, and then you can give them to your doctor and they can dispose of them. Do not throw them in the trash. Now it's time to go get another bag. This is still sterile, and I'm going to put this in a brand new Ziploc bag. I'm not going to reuse the bag to try and keep it sterile.
And that's it. Have a great one, guys.